Top Med Talk.
Well, hello and welcome to Top Med Talk. I'm Desiree Chappell and I'm joined by my co-host in London, England, Monty Mythen. Hello, Monty.
Hi, Desiree.
Well, Monty, like I said, we should be in San Diego at the American Association of Nurse Anesthetists 2020 Annual Congress. But we are joining virtually this year. They are having a virtual meeting. So the AANA is our governing body and our professional organization, actually, for CRNA, so Certified Registered Nurse Anesthetist. And those that follow us on Top Med Talk probably know that I am a CRNA myself here in the United States. And you being an anesthetist, anesthesiologist over there in the UK. The AANA is my professional organization, and we have partnered with them to do these conversations. So we want to say thank you to the AANA for supporting us to do this and to be part of this first virtual Congress that they're doing. Well, let's dive into our next presenter here, our next guest. This is another presenter doing the AANA 2020 Virtual Annual Congress. And the title of his presentation was Up in a Puff of Smoke, E-cigarette use and its impact on patients undergoing anesthesia. We have Bernie Gilligan joining us today. Hi, Bernie. How are you?
How are you? Thank you for having me.
Yeah, absolutely. Thank you so much for taking the time out to join us on Top Med Talk. I know life is a little crazy right now with all the stuff with the COVID going on, and we all should be in San Diego. But tell us where you're coming to us from.
I'm actually coming to you from Pennsylvania, from near Scranton, Pennsylvania.
Nice.
And although I have to say, with Monty mentioning his island meeting and my last name being synonymous with that, I feel that I'd be a natural, so consider me for that.
All right,
You're in.
Well,
You're in.
It's the island of Ireland, so
Ireland, yeah.
it's great. Well, Bernie, tell us a little bit more about yourself and your practice.
I am a practicing anesthetist here in northeastern Pennsylvania. I'm also the assistant program director at the Cedar Crest College Nurse Anesthesia program in Allentown, Pennsylvania. In addition, I have my own venture as an educator for Promethean educators, which has a combination of topics that we cover, including recertification and original anesthesia topics.
Okay. Well, tell us more about that. What is Promethean education? What is that?
Promethean anesthesia educators is basically my goal is always to reach out to, as you are, as many people as possible. And I had a lot of requests. I've been involved in anesthesia education as either simulation director, program director, or assistant director for about 12 years. And, having students, past students come back and say, can you do a lecture for us? Can you, we have this variety of educational needs. And often they were regional meetings. They were not, I have spoken nationally, but most of what people need is something that they can get in their own workplace, but maybe isn't delivered by the people who they necessarily work with. They want to hear some different perspectives. So been involved in that for about 10 years and something I enjoy greatly.
Oh, that's fantastic. Well, Bernard, tell us a little bit about the presentation that you have done. When are you actually presenting?
I believe that in speaking with some of the people at the AANA, it is a mouthful, by the way, to roll off the tongue, that we have that the presentation will actually be released immediately following, because they're going to roll out presentations over the 30 days following the original dates of the Congress.
Great. Yeah, that is one benefit, definitely, of having a virtual Congress. We know people can't sit down for 8 hours at a time and just listen to lecture after lecture after lecture, which sounds a bit intimidating now as I say it, but it's never a problem when you're sitting in San Diego or whatever.
different environment definitely makes it more possible, yes.
Yeah, for sure. Well, tell us a little bit about your presentation here and e-cigarette use, because this is something that on Top Med Talk we haven't really discussed that much. It is becoming much more prevalent in the U.S. at least, and I know Monty, actually we had a little bit of discussion about this, I can't remember on Top Med Talk or EdPom, about the fact that the U.K. is now transitioning to suggestion of e-cigarettes to stop smoking and smoking cessation.
Yeah. So the NHS certainly initially supported the transition from cigarette smoking to e-cigarette using as a way of getting yourself off traditional cigarette smoking. But it was advice based very much on, there is some evidence, but it sounds like a good idea. Now you need enough time to pass to make sense of the reality of whether it is a safe transition or not. So I look forward to hearing what you've got to say, Bernie.
Yeah, absolutely. Go ahead, Bernie.
That is actually, where I began with my motivation for really digging into this topic, in addition to what I experienced as an anesthesia provider, is as a parent of a teenager, to be very honest with you. Smoking is something that has always been the rebellious venture of young people. And it really, obviously with smoking with combustible cigarettes, we've gotten to the point where we define them between combustible and e-cigarettes. Combustible cigarettes obviously were hard to conceal and were, had really started to fall in popularity, although they held on for quite a while and are still holding on. They were less possible for young people to experiment with, especially, in the school environment. Electronic cigarettes are really aimed at two populations. And there is, with one population being what you had mentioned, the pre-existing smoker who is attempting to quit or wean. There was initially the thought that, okay, maybe this is not a bad idea. The second population would be the never smoker. And in truth, what the statistics indicate is that really is who many of these are aimed towards. And we're talking about middle school children, and on up that we're seeing usage of electronic cigarettes. Very concealable. Yeah. The smoke, the odor is not there like it is with the cigarette. It's a completely different profile. And this isn't something that is new either. I think we've seen it surge in the last 5 years. That's what what most of the research indicates is in the last 5 years, you're really seeing it spike. But this is something that really began quite a long time ago. And the thought of it, the thought of weaning people from smoking was the original thought. As far back as 1967, which is actually when the original patent for the e-cigarette was made in the United States. Actually a Pennsylvania resident, Herbert Gilbert, 1967, who coined the first e-cigarette patent. That was developed but not able to be delivered because of a variety of issues. But the idea was there. Towards the 90s, as the medical community and as society began to recognize the risks of smoking, the cigarette makers, tobacco companies began to pivot and start to do research. Around 1990, one of the large tobacco companies began to do research on vaporization of nicotine and the methods that could carry that out. And in addition, all the things that went along with it, the batteries, there's a whole complement of technology that needs to go with that for it to be successful. And it's taken quite a while, and it is really, in the last 10 years, it's increased. In the last 5 years, it's just surged.
Yeah. It's really hard to kind of wrap your mind around. I don't have teenagers, so I never really thought about that aspect of it. It's aimed at the never smokers, and it's not like, an adult who's never smoked. It's aimed at those kids who, it's just kind of like what smoking was, 40 years ago or 50 years ago.
Absolutely. And the thing about this, Nick, there's a variety of concerns. The volatile organic compounds that are inhaled are one component. Nicotine, we actually know quite a bit about nicotine because of our studies, our research that exists from smoking. And we know that has a whole set of, physiologic problems, psychological addiction. The list is long, and we're fairly familiar with that, especially as anesthesia providers. The things that may not be factored in, as far as the contents, are things like the ultrafine particles, some of the metals that are in the compounds, and even the flavorings. Whenever I start talking about e-cigarette use, somebody usually raises their hand and says, "Oh yeah, that thing with popcorn lung."
Yeah, that's what I was going to say.
It is. It's that kind of memory item, the people that pop up in people's memory. And that actually stems from an incident that the widespread knowledge in society of that spread from an incident in a manufacturing plant where they made popcorn, and that diacetyl was the buttery flavor for the popcorn. And that diacetyl is also the buttery flavor that they use in vape juice. That's the term they use for because this is not meant to taste like a cigarette. These are not, the vape juices are not meant to taste like a cigarette. They're meant to taste like popcorn, candy. When we did our presentation, I put a lot of visuals in there of the types of flavorings. And when you look at them, they're not offensive. Most of us, if you don't smoke, if you think about being around a cigarette, it kind of takes you back. Maybe it's a little bit of an offensive smell.
But it's very appealing to young people.
Absolutely. People who would normally not be attracted towards the smell of, burning tobacco and paper would absolutely, everybody loves popcorn, maybe not everybody, but it's a more appealing, widespread flavor. So that those factors are things that we really have to start to think about. And as anesthesia providers, of course, we don't have the data yet. We don't have the long-term data. What we are seeing are younger people. This is anecdotal, but they're young people who are presenting with more complex pulmonary issues than we've seen in the past.
Now, it's the use of e-cigarettes is ubiquitous, right? Like everywhere in the U.S. and I would imagine pretty much everywhere in the world, you can get these now. What kind of industry are we looking at here? What's the scale of this?
The scale of the industry, in 2018, this was a $14 billion industry.
That's incredible.
It is, it is amazing to think about and if you look at statistics also, the U.S. definitely leads the world in e-cigarette use, by far, by major amounts, Japan being second.
Oh, wow. That's really interesting as well. So, you've touched just briefly on it about, pulmonary complications. And can you dive into that just a little bit more? I mean, what are some of the specifics that, not necessarily just in anesthesia, but that we are seeing with the use of e-cigarettes?
What we're seeing, and I guess something else to really start with as far as baseline material is the idea of using an e-cigarette is sort of the general umbrella. What can be vaped or used in an e-cigarette is a variety of substances. What I was discussing a few moments ago was vape juice, which is either a propylene glycol base or a vegetable glycerin base. Now, take your knowledge as an anesthesia provider and imagine aerosolizing oil and then inhaling it repeatedly. It presents, that is with vape juice, and that presents with a more chronic, lower acuity issue under normal circumstances. The scope of it under anesthesia is basically atelectasis, sometimes trapping of those oils by our body in order to try to eliminate them, but a very difficult time mobilizing those secretions. Now, to go on with that, one thing to remember is that there are other substances that can be vaped, and I use the term vape widely. There's something called dabbing, which is vaping of marijuana, and that is really where we have seen an increase, the spike that we saw within the last 2 years. In fact, it was during the AANA meeting when I was speaking to several people, because it was all over the news, where we had young people, 16, 17, 18, 19 years old, who were hospitalized on ventilators in ARDS or with serious pulmonary complications. Much of that was linked to dabbing, which is it's basically a marijuana oil. It's like a tarry, more of a tarry substance that's used to inhale, and of course it's used for the effect, but the after effect, this is where we're seeing the major physiologic complications and acute issues. Additionally, there are also alcohol can also be vaped.
What?
Yes,
that's crazy. It
is. There exist options for vaping alcohol. It has a very rapid uptake. The amount of intoxication and how rapidly someone becomes intoxicated is I guess you'd say it's the attracting factor, but it's also very dangerous in the sense that acute intoxication and over intoxication can occur within a narrow margin.
Well, I know that this is a relevant conversation for an anesthesia, but I do have to say, as a parent to two young kids, this is very informative because I've been completely out of the loop. Things have changed since I was in college and, and a young person. So I just had no idea that all those things were. So are there any, Monty, what is your experience with e-cigarettes there in the in the UK? Have you heard much about its impact on anesthesia care?
Well, anesthesia per se, less discussion. In society, and the fact that there is a potential market there, there's a potential, it's a big commercial market. It is, as you say, it's appealing to people as a different way of getting drugs into their body. It's got this sort of hint of the fact it's better than smoking, and therefore it's a sort of safer thing, and it's got a bit of NHS approval from that angle, but that wasn't the same as saying vape alcohol or vape marijuana. So it's complicated, and and where's the regulation on it? Where's the health guidance on it? Where's the parental concern about it? Because you're at risk of turning around and saying, well, 15, 16-year-olds are going to experiment, at least they're not smoking. But do you know what they're vaping? Just because they're standing around blowing smoke, if you see what I mean, temporarily, what's going in and out of that, and who sold it to them? Complicated.
Right. The other aspect of this, an average cigarette in the United States, anyway, I don't know the variety around the world, but the average cigarette in the United States has about 10 to 16 milligrams of nicotine. Vape juice can literally have from no nicotine, from zero nicotine, up to around 36 milligrams. So every use of it could be the equivalent of smoking 2 or more cigarettes, depending on what. So the amount of nicotine that people can ingest, and often do, in conversations that I've had with vape users, they often do find that they have to use more to achieve the same effect. So there's this escalation. And I think in cigarette smokers that people have found that they maybe have switched brands to achieve that same effect. But with this, it's literally buying a different juice that's more potent to allow that.
Is this regulated at all by the FDA?
It is, it's the old adage that you try to regulate things. However, what I will tell you is that I can say in my state, and I don't know in other states, they have recently raised the age by which you can purchase these substances. And often they are sold in vape shops, their specialty store, although they are sold in gas stations and et cetera. They have recently, in the last year, increased the age from 18 to 21 to purchase. However, I don't know the impact of that. As with in the United States, obviously alcohol is at 21 years old, and still younger people are able to obtain it. So I would say it follows those same lines and maybe those same sources. Who knows?
Yeah.
Go ahead.
We'd all recognise there's a risk in the regulated and in the partially regulated market. But there's also the potential of a huge, let's call it, black market. In other words, a marketplace in which things have come along that who knows who put them together. But that's what kids in particular are at risk of those purchases.
That is the inconsistency in production, the inconsistency, and to go on beyond what we have discussed to this point. The inhaled substances are one component of this. There are two other components that I think it's important that I mention while we're talking. Fires, explosions, poisonings. These e-cigarettes have a battery to them that produces, it basically fuels the vaporizer to allow it to function. And there are a fair number of cases, which I detail in my presentation, of facial injuries, ocular injuries. Oddly enough, vaping is mostly a male habit. Not that it's not an equal distribution. It's predominantly male. And often these are concealed in the pocket. So many of the injuries are to the leg genitalia and anywhere where they might be stored. And
that no pun intended, blows my mind.
I would say if there's any motivation to keep these away from your body, it's that would be the greatest, right? Yeah. Also poisoning. The idea of having these substances around in pets or small children, getting a hold of them and ingesting high amounts of nicotine.
Kill them.
And that's the thing. It's of course there's a lot of factors that go into that, but ingestion of it will undoubtedly cause poisoning, let alone possibly death. So These are very concerning factors, and I think that's what drove me. The final thing, and this really hit me in the last few weeks, so I'm glad the timing of this worked out. There was actually something released in the last 2 weeks regarding the incidence of COVID. And you might say, okay, well, how are you going to connect these two things? Well, these vape pens are shared. I mean, maybe everybody has them, but often friends will be like, hey, did you like a hit? And the incidence it was a study released from the folks out at Stanford, that the incidence was significantly higher, and the severity of their illnesses, if they did contract COVID, was significantly greater. And that was something that in doing this, I've done this talk for a while. That is a new turn in it. And actually, COVID had sort of overshadowed some of these concerns. But when you think about children returning to school, children, and I say children, but young adults, truly, sharing things and not thinking of it. Maybe they wash their hands and wear their mask, but then they share their vape pen. It's
kids.
It's a setup for failure. So there are many concerns beside the obvious nicotine ingestion.
Yeah, sure.
And that's very recent, that publication from Stanford. We've seen that in the popular press over here now, giving a much more solid signal to say not only is there the transmission risk you're referring to, but possibly the opportunity by bringing the COVID-19 into the lung, combined with possibly a nicotine hit, combined with a bit of acute lung injury as a result of vaping. It all makes sense. And now the data is starting to emerge epidemiologically that teens are getting a worse result from COVID-19 as a matter of being a vapor. So at the moment, that's possibly a stronger message to parents to get through to their teenagers, because it's a bit more tangible. Bad stuff might happen in the future. It's very hard to always, I'll be all right. I'll stop when I'm 30. Right. Yeah, exactly. Yeah. But the here and now of the COVID-19 is that some teenagers have ended up very, very sick, and possibly it was the vaping that contributed to that.
On several levels, both the exposure and their baseline health status and pulmonary status.
Yeah.
And
I think that's very new from Stanford, so we should get the link to that in the show notes as well.
Yeah, yes.
Absolutely. Well, Bernard, tell us, as CRNAs, as anesthesia providers, I always like to ask this question, how do we take this information, this knowledge now, and really apply that to what we're doing on an everyday basis? We see somebody come in who is an e-cigarette user, which, to be quite honest, I'm thinking, does my pre-op evaluation even ask about e-cigarettes? I work in an anesthesia care team model, so I don't believe that we're actually asking explicitly about this. Walk us through some of those things.
I'm going to interrupt for 1 second there, Desiree, because I've got a takeaway that I'm, scribbling down to take forward. Is now, I think the question probably isn't, are you a smoker or an e-cigarette user? I think what I've just heard from Bernie is we should ask people if they vape anything at all.
Oh, yeah.
Yeah, because that's the bit I've been getting from this is, there's a more complicated, nuanced question here. Oh, I don't do any of that nicotine stuff, but I do a bit of alcohol and a bit of, bit of popcorn juice.
People draw the lines very, very in their own mind. They draw lines that unless you ask the very specific question, in my experience, and I'm sure in yours also, that if you don't ask the question, they won't give you the answer. They will generalize. No, and actually the cornerstone of it is often in the pre-op assessment.
Yeah.
If you have somebody with known severe pulmonary issues, it becomes one more factor that I think we think about. But I think asking direct and defined questions related to their use in a non-judgmental way. I mean, these are, and the age group, often parents are present or loved ones are present. Some people, what I find more often, I'm older than these folks, so they don't seem to be as hesitant as I probably would have been had I been
right. I would have never said.
Sometimes it's they're very transparent with their use, and other times they aren't. But as we do with some other sensitive topics, I always say, this is in order so that I can provide care safely for you. I'm not casting any judgment on you, but the idea of asking those questions, like as Monty mentioned, do you vape? Do you dab? Do you ingest anything else? And it's a lot to do with the medications we give and being able to safely provide anesthesia for you. And we need to know. That's one component. I usually have a higher incidence or a higher lower threshold for seeking or for looking at bronchospasm or expecting bronchospasm to occur, excessive secretions, challenging wake-ups with a lot of secretions. My personal experience and experience of many of my colleagues has been that in people who are very frequent vape users and who also utilize dabbing or marijuana. That's where I've seen it the greatest. But it basically raises my index of suspicion. We are in the process, and I hope it continues to gather more data that is more defined as far as some strategies that we can implement. But a lot of it is we have to sort of, intuitively, maybe not intuitively, but we have to expect that someone who is inhaling vegetable glycerin multiple times per day is going to present in a certain way, and we may have to modify, maybe our ventilation strategies or our approaches to this slightly differently.
So is the old guy here in the same way as that we used to, be worried about asthmatics. Not saying we're not still worried about them, but asthmatics who are mild asthmatics or smokers who are heavy smokers, we would be going forward to saying, well, we wouldn't be surprised if they got a bit of bronchospasm, or we wouldn't be surprised if it was a bit messy around extubation. It's the same mindset. Is that right, Bernie?
Yes.
We're saying that's on our radar now.
It is. And could there be more? And as time passes, and if people continue to, which we don't know, the longer term effects could present very differently and could present more seriously. Being that 5 years has really been the increase, that's where the incidence occurs, it's probably less frequently than it may be in the next 5 years if the trends continue in the same direction.
Yeah.
And the severity may be greater.
Yeah, for sure. We're going to have a conversation in this weekend about marijuana use and dealing with patients who use marijuana. So, this is kind of like a twofold thing because, adding vaping and marijuana together, I would imagine would be kind of like a double whammy a little bit. Because, we all know that, marijuana users, have increased, narcotic. There's a bunch of different things. Right. So can you talk about that for just a second?
The one aspect that really does become a challenge with that at this point is what else is in the substance. Mm-hmm. These are not, you're not buying these at the drugstore. You're buying them off the black market, as Monty had mentioned. So what seems to be a real challenge with all substance use, but including marijuana, is what else is that person ingesting? Marijuana, we have some defined evidence of the effect of it. There's more strains of marijuana than ever with legalization and with things. So, it could be saying like, this person drinks. Well, do they drink Chardonnay or do they drink grain alcohol? The intensity of the marijuana itself is one factor, and then the added aspects or added substances may be another, and that they are often unknown until you get a drug screen back.
Yeah, that's absolutely true. And, with the fact that marijuana is now legal in many states and, these, different marijuana places that sell it, that's all, like you said, there's like all different kinds of strengths, there are all different kinds of tastes. There's all these different variations may be affecting all of those things. So
it is a moving target.
Yeah, absolutely. Well, like I said, fascinating conversation for anesthesia providers and those in perioperative care, even better for parents of young kiddos and teenagers. This really opened my eyes to, this potential, risk for my kids. So I really appreciate the work that you're doing in this, Bernie. It's great to be out there and sharing this with the broader group, because it's so important to hear.
It's it's one of those things when things hit close to your heart and close to your professional life, especially when they hit both. Yeah. It definitely is something that I take very seriously, and I want to try to help especially the younger folks who may not have understand what they're actually exposing themselves to.
Yeah, absolutely. Any other topics that we didn't hit that you wanted to go over that we covered?
No, I think I actually had the opportunity to hit my talking points, and the ideas of the fact that there are the three aspects. Not only what you're inhaling, but the fact that literally having it in your pocket can be a risk. Mm-hmm. So that is shocking in and of itself, and for most people. And then the new evidence related to COVID. Those three aspects are what I would like people to walk away thinking about, and maybe paying a little bit closer attention to the research that's emerging. Usually, it's fairly well publicized in the press, but if you look in the in our journals and in medical journals, we're starting to see it there. And as the studies become more added substance and longer term, we are going to hopefully have better data as time moves on.
Yeah, great. All right. Well, Bernie, thank you so much for sharing this with us on Top Med Talk and taking time out of your busy day. Like we said, it's a little crazy with being at home and everything like that, but we really do appreciate it. So thank you very much.
Thank you very much for having me.
Yeah. And thank you for listening to Top Med Talk. You can always find us on social media, Twitter, LinkedIn, Facebook, as well as topmedtalk.com. You can subscribe to us there and on your favorite podcatcher. So be sure to check us out. We did mention the EBPOM meeting that you can find at ebpom.org. We have a big virtual conference coming up in a couple weeks around perioperative medicine. So kind of some of these topics and expanding and more. And we just wanted to say thank you so much to the American Association of Nurse Anesthetists for supporting Top Med Talk for these fantastic conversations. I'm sure we're going to have many more as the days go on, and we will see you soon. Thanks for listening.
Top Med Talk. Thanks for downloading Top Med Talk. Don't forget to subscribe via your podcatcher. Don't forget to check us out on social media. We're on Twitter, Facebook, LinkedIn, and YouTube. And also, don't forget, Top Med Talk is the broadcasting arm of EBPOM, Evidence-Based Perioperative Medicine. We'd love you to find out more about that. If you check out ebpom.org, you can find low prices on some of the conferences we're organising around the world. Many of them are virtual and don't even involve you leaving your own home. Check out ebpom.org now.